Hi there, my name is Debbie Stevens, and I'm the director of the CLL program at the University of North Carolina. And I'm really honored to be joined today by Dr. Jennifer Woyach, who is the section head for CLL and the co-director of the Leukemia Research Program at The Ohio State University. Thank you so much for your time today and for taking time to answer questions.
I'm excited to be here.
Great. Today, I'd specifically like to talk about an abstract that you presented at the ASH meeting in 2023, which was entitled T-cell dysfunction and exhaustion in patients with CLL, the impact of long-term ibrutinib treatment. So before we get into the research, can you describe what is a T-cell and what does it mean if it's exhausted?
No, absolutely. So a T cell is a type of white blood cell that is really important to the immune system, and particularly it does what we call cellular immunity, which is the ability to kind of recognize and proliferate after antigens or kind of foreign things that the cell might have encountered in the past. So T cells are really important both in infections. They're important in helping generate antibody responses to vaccines and important also in anti-tumor surveillance. And
Okay, so
so exhausted T cells are ones that don't really have the capacity to generate new immune responses anymore. And we see that this is really common in patients with CLL, and probably one of the reasons why we see, more infections, more other cancers in people with CLL.
that's great information, and I can see how this is really important to patients. Because the immune system is always something that folks with CLL struggle with. So tell us about this particular research project.
Yeah, so a number of groups have demonstrated before that drugs like ibrutinib, so inhibitors of Bruton's tyrosine kinase, and probably maybe specifically ibrutinib, which has more effects on T cells in general, can make T cells in patients with CLL look more normal or behave more like a T cell in somebody who doesn't have CLL. And this has primarily been shown in early studies and going out to about a year or so, but nobody had yet looked at those patients who have been on ibrutinib for many years. So we took samples from patients who had been on ibrutinib for at least 5 years with a continued response, took samples baseline 3 years after they started ibrutinib and 5 years after they started ibrutinib to look at how their T cells function.
Okay, and what were your major findings of this project?
Yeah, so we found that similar to kind of earlier data, we do see that patients who are on long-term ibrutinib have more T cells in general, and those T cells are able to proliferate in response to stimulation better than people before they start ibrutinib treatment. We, however, don't really see the T cells completely normalized. When we compare it against people who don't have CLL, or even kind of people who have CLL that's never been treated before, there still are some deficiencies in the T cells in patients who have been on long-term ibrutinib treatment. And so this kind of tells us that the T cells are getting better in patients who have been on for longer periods of time, but really are probably never getting back to the point that they were before. The important thing, though, about them getting better over time is that it may be the case that you then can use other T cell therapies along with a drug like ibrutinib or probably the other BTK inhibitors too.
Okay, that's great news that it looks like the T cell function does get a little bit better, but still could use some work in helping the immune system for folks with CLL. So your particular research was done on patient samples. Are there do you have any ideas how we could make T cell exhaustion better for patients?
Yeah, that's a great question. And I mean, I guess it's still a little bit of an unknown. So we see hints with some drugs that we can make T cell function better. So, like I mentioned, the BTK inhibitors, it's been shown after like venetoclax obinutuzumab that T cells can work better too. Drugs like lenalidomide and kind of cousins of that drug can also make T cells work a little bit better. And I think, the goal of all of this would be to be able to use a drug that helps restore T cell function to then allow for another therapy to come in and work better. And so that might be something like a bispecific antibody, something like CAR T cell. And in addition to that, so in addition to like working against the CLL cells, we also hope that when we use drugs that help restore normal T cell function, that we might help people have less infections. We might have people have less second cancers too.
This is very interesting. Thank you so much for doing this important research, and thanks for taking the time to talk with us today.
Thank you, Debbie.